So today I'm going to be going over priming your IV tubing, and as you can tell I've already had to do it once, so this is my second try. You want to make sure you keep your spike sterile and also your caps like that, because they are coming into contact with the medicine that's going to be going into your patient, so you want to make sure that medicine stays clean and doesn't become contaminated. Okay, so to get your spike in, there is a little piece that is on top of where the spike goes in, and it looks like this. It's that part that you have to twist off. So I twisted that off, and you have to take your spike, and there's a cap on the spike that looks like that, and that keeps it sterile and clean so that nothing contaminates it as well once it goes into the medicine. But you take that off, and then you kind of have to really twist this down in there to get it into the medicine, or at least as far down as you can, so it comes into contact with it. So that's why it's important that it stays clean. And then also, if you use the caps, you always want to make sure you use a alcohol wipe, so it's clean when you do use it for your patient. And this bag always has to have information on it. You want to check the expiration date to make sure that it's safe for your patient. You always have to have the patient's name, the date, the time that you infused it, your initials, and the amount that's going to be going into your patient, so that that information is readily available, so if anybody needs it, they can look it up. Alright, and now I'm going to hook this up and we're going to prime our tubing. Okay, that's my makeshift IV pole. And before infusing it into your patient, you want to make sure you did your 3 checks and the patient's 5 rights. And so for the priming your tubing, you want to make sure that this always stays untangled and it's not getting clamped up or anything. Okay, so you would also have a sink or something at the hospital to put the fluids in, but I don't, so I'm using my trash can. But you want to squeeze this chamber about halfway to 3/4 full. So I'm going to go ahead and do that. And my roller clamp, it needs to be unclamped when I do this, so I can get it in my trash can. Well, there we go. I'm going to go ahead and clamp it. Okay, so I got it a little bit above halfway. So now I'm going to unclamp my roller clamp here. And make sure that goes into my trash can. And I just want to make sure that all of my tubing gets out the air bubbles and that everything in the tubing is coming through. Like I said, this would be more practical with a sink. Okay, now I'm going to clamp that back up because my tubing's full and we got rid of all the air bubbles. Okay, and now that that's full, I would just make sure that I used clean procedure when hooking it up to my patient, and and just making sure that everything's okay for my patient.